And this is the work of Norm Hoffman. So if you want to get more information from him, you can ask him about his Big Five, which is in looking at populations, the ones that really seem to identify the most severe substance use disorder are these: wanting to cut down and unable to do so, craving with compulsion to use, people when you're sacrificing important occupational and family social activities to use, failure to fulfill your role as a parent or in a worker, or in other words, it's affecting your role functioning, and then withdrawal symptoms. These ones often define the greatest severity. The ones that, of the 11 that are not as associated with severe addiction, are unplanned use, the time spent using substances, some of the medical and psychiatric consequences of use, use where impairment is dangerous, interpersonal conflicts, and then legal issues and using to relieve emotional discomfort. Now, the reasons for trying to think about mild, moderate, severe is because that's what DSM-5 does. And, the clinical implications of that is that if you have mild substance use disorder, that might be the category of people who we can intervene with screening and brief intervention. Many of those people in the healthcare system, general healthcare system, we can reach out to those. Those who are more severe are the ones who might end up more in very specific specialty addiction treatment programs. And we don't have time to go into this, but it means that as you think about severity, you might have different interventions for severity where you really want to track people with severe substance use disorder much as you would track any other chronic disease, because it's not a matter of just graduating from a program and then being cured. Whereas if somebody has more mild or moderate substance use disorder, you may be able to involve them in less intensive services. Now, having said that, even somebody who has a severe addiction, if they are not wanting to have long-term treatment, you have to still use motivational enhancement strategies with that person. So what DSM-5 does for substance use disorders is no substance abuse, no substance dependence, but mild 2 or 3 of those 11 criteria, moderate 4 or 5 of the